We're going to talk about some of the myths and facts about spinal manipulation. Some people say the spinal manipulation or cracking their back saved their back. Others said they sent them to the ER. What's the truth? It's kind of somewhere in between. So what is spinal manipulation? Basically what it is when a practitioner or someone applies a high velocity, very quick, low amplitude thrust, like a stretch to the spinal column that's supposed to restore motion, reduce tension or muscle spasm and such, and just generally relax the area. And it often feels very good. Myth 1. Does the cracking sensation mean that you're actually realigning the bones during a spinal manipulation? Actuality, it's really not really aligning the bones. What they think that it's actually doing is actually reducing the pain in the area briefly, kind of modulating the pain, causing the body to relax, reducing muscle tension, kind of like an analgesic effect, similar to taking an anti-inflammatory. When you have that, sometimes you'll have people have improved motion, they move better, they may be standing a little bit better, but they're not actually realigning the bones, okay? So realize that, but it can definitely create changes in how you move and feel. One of the beliefs that what the cracking actually is a change in pressure in the joint called cavitation. So that change in pressure causes an audible snap. In some research, they show you don't actually, for improvements with a spinal manipulation, you don't actually need to get that cracking sound, but often people associate a successful spinal manipulation of that audible crack. If I didn't get the crack, it didn't work. And that's actually not been shown to be true. Next myth is spinal manipulation is only performed by chiropractors. Not necessarily. You have other practitioners, including physical therapists, osteopaths, that actually have been trained in doing spinal manipulation. But what I will say is you want someone that does a lot of spinal manipulation so you get the greatest success. If you do a lot of one thing, you just get better out of it, and you really want someone that does a lot. So really look for that in any kind of practitioner if you're seeking this type of treatment. And often the treatment should be paired with other approaches between exercise, modification of activities you're doing, some type of strengthening, cardiovascular work. There's a lot of things that go into it besides just the manipulation. If it's just a manipulation, you're probably not getting the most out of your treatment. Next myth, spinal manipulation is just a placebo effect. Actuality, it shows that there's actually moderate benefits in a study done in 2017 by JAMA that actually has some real effect or improvement in someone that has acute lower back pain. So we're talking about the first few weeks, even lower, I would say first 1 or 2 weeks that you experience an episode of acute lower back pain. So consider that. It actually has some improvements. It's going to be on par with taking anti-inflammatories or other types of medications for this condition. Next myth is spinal manipulation is necessary to do a maintenance program of getting manipulation every few weeks. That has not been really shown to be true. Maybe the research just hasn't caught up to really what it's doing, but it really shows that typically a good approach is emphasized on an active approach, meaning not just passively getting stretched or getting electric stim or moist seat, is more of an active approach, getting someone to be aware of their posture, giving them some exercise, would be stretching or strengthening, whoever's appropriate to the individual, and understanding how possibly this condition started. It's part of a whole treatment approach, but actually getting it as a proactive thing to maintain is hasn't been really been shown to be true. Next myth, spinal manipulation is appropriate for everyone. It's safe for everyone. Not necessarily. There's certain percentage of people that you have to be careful with, that you should not, as a contraindication, you really shouldn't do it. And as someone that has severe osteoporosis, their bone densities are very weak, they're more fragile, you may compromise that and cause a fracture. So it has an acute, really active inflammatory process, meaning they have rheumatoid arthritis or they have some inflammatory condition where it's really inflammation that this causes, and you can actually make them actually feel worse in those conditions. So, and it has certain types of bleeding disorders. There's also other people I feel, it's a relative, I would say precaution, maybe not a contraindication, people that have hypermobility or Ehlers-Danlos syndrome, EDS, so you have to be aware of those folks that they're not always appropriate. A recent fracture, depending on the stage of the healing, you have to be aware that may not be appropriate for those individuals, and you want to make sure that your practitioner is aware of those things, especially when they go over your medical history. Last myth, spinal manipulation is dangerous and can cause serious injuries. Generally, spinal manipulation is relatively safe. There are a small percentage of people that do have complications from it. I will say people that have can get a stroke from a vertebral artery dissection. Basically, the artery within the neck there kind of gets crimped, and when they do the manipulation, it induces and can cause a stroke. So we have to be aware that that is one of the rare cases. You have cases of nerve damage where you have someone that has a very active disc or disc problem, and it's complicated by you getting a spinal manipulation. Most important thing is really discussing your medical conditions with the chiropractor or osteopath or therapist before you undergo that treatment, so you understand the relative risk, and the physician can advise you on whether or physician or practitioner can advise you on whether it's whether it's safe for you or the relative risk. But different types of vascular problems, other like I said, active infections, different things like that. Those are the kind of things that we have to consider prior to doing the manipulation and understand those risks. So spinal manipulation generally is relatively safe, but you have to have good communication with your practitioner to really understand the relative risks and really have a good dialogue prior to actually getting a manipulation. And also even for yourself, if some people do some self manipulations and cracks, and be aware that there's certain times that you could be putting yourself at risk. So be aware of those possibilities. I hope this helped you out a lot. Most times treatment of various spinal problems, it's multimodal. There's several different approaches besides the manipulation through exercise, activity modification in your life, posture, cardiovascular training. There's various things that are going to go into approach for spinal care. So it's part of typically a comprehensive approach is the most successful. Hope this helps you out. If you enjoyed or got something from this, please subscribe, hit us with a quick like, or shoot us a comment. If you're interested in future videos, turn on those notifications so you know when the next one actually drops. Have a great day.